And the Aga Khan University Hospital has launched its home care service as part of its strategy to increase access to quality care and to take its services closer to where people work and live. Among the services offered under the home care service include nursing care, physiotherapy, chemotherapy, doctor's visits, counseling, psychology, nutrition support, palliative care, collection of samples for laboratory testing, free delivery of medications and wound care, among other follow-up care services. The service is part of the hospital's decentralization of services from the main hospital to the neighborhoods and will augment the services offered by the wide outpatient network of 53 centers spread across Kenya and Uganda. The home care service is currently available in Nairobi and its environs, with plans to expand to other areas.
And we saw during COVID what happened in the first few months. People stopped coming to the hospitals, especially people with the chronic conditions. People with cancer, people with diabetes, people on dialysis, they stopped coming to the hospitals. And what happened then? If you are not treated, if you don't get the care when you need it, then the condition will deteriorate. And that's what we saw, that in the March of 2020, the hospital occupancy went down, the patients were not coming to the hospitals. And then when the COVID vaccines came, the occupancy was more than 100%. Because people were even more sicker when they came back to the hospital. And we want to avoid that, because not only it is the patient who suffered, the family who suffered, but also the cost of treatment when you are seriously ill went up. You would not land in ICU if you are treated when it is needed. So that's what we saw during COVID. And I think that was the motivation for us to start the home health program. So if the patient is admitted in our hospital for whatever reason, the data is electronically available. And when the care provider, when they go home, that same data is available. So you're not missing out on anything, and you don't have to carry huge paper charts to the home as well.
As we talk about universal health coverage, coverage is about how you can cover as many people as possible, preferably 100%, not with everything, but at least with certain basic services that improves their health. Every human being wants to live long, okay? And the longer you live, more complications come. Now, if you look at, say, 100 years ago and life expectancy today, we probably, in some societies, have doubled life expectancy. The way medical care is moving now and research in medicine, probably even by 2050, the average life expectancy will be over 100. Now, living longer with a chronic disease, you can imagine the burden it will have on the community itself and healthcare services. That burden will be colossal. And so therefore, I'm glad that this innovation has come, which is reach out to people at home so that then healthcare costs can come down. I'm happy that AKUH has understood the new customer value proposition.